Onetv special report.
Yes, permission to speak, Madam Chair. So, karon nga accreditation, walay tricycle organization na accredited.
Sa pagkakaroon.
Nagtatagong nila o kuan, requirements, pero wala sila na submit. Na sila i-forward nila.
So,
Karon pa.
salamat.
So, automatic, Madam Chair. So, automatically, Madam Chair, wala sila, delete. Kung wala sila maka-accredit body, wala na sila.
Pero sa una na, siguro in the last
Ang tumugan
Ang last na accreditation was 2021. Prior ananas na ay
Tumoda, sarap.
Pero
Wala
kung
na review.
2021,
Wala na ka-apply.
Wala ko rin yung sabihin.
maski recognize, wala sila nag-recognize tayo. Wala lang sila forward na documents.
Okay. So, shall we await for the MTOP?
Madam Chair, natin sumpay, Madam Chair, ha? Kay, ikalungog mo ganyan ako tiglutan. Amat na pagsiguro kahit maminaw na maghimo ng tag-organisasyon para lang sa ayuda. Kaya utak kadawat. No? Anak may rason.
No. It's not that. It's not nga nag-organize na. Gusto sila magpa-accredit para makalawat ko sila o
Mong ganyan.
Hindi siya nag-organize sila po ayun. Nagpa-accredit para isipro sila mo receive o mga na sa una, like DUV. Ang matagal ka project, kinaka-accredited ka. So not necessarily ayuda. Basta receive of funds lang ba? Hindi, pwede mag-partner sila. Ito na natin programa sa LGU. So, ito na lang. Wala to na to. Ang ilang membership. Sige na. Okay. So, let's go to the next item.
Barangay Resolution number 18, sila sa Director of the Purong, Madam Chair, this is pending for was to board resolution.
Wala yung payos ko. Wala may patawag for one meeting. Ang was to board, wala may patawag for meeting. Wala may man kami sa board.
Madam Chair, na ay patawag sa board.
Pero nuling item D, Madam Chair.
Okay, same with item D. Okay, item E.
Item E, ang memorandum of agreement.
Okay.
Committee on Hall, Madam Chair. Last week,
Wala
last
yung
week daw.
committee report. Kumanaman ni. Where is the committee report? Committee on Hall report. Boy, wala pa. So, pero ako na rin, deliver sa committee on Hall. Ako na lang, draft. Ang draft na lang ito. So, kayo prepare the draft, no, secretariat, Toy, para deliberation. Oh, I think, kuha na to. Kuha na to siya. Gamay na lang, forward na lang ito sa safety, tapos mabalik din eh. Okay, so, item F, wala, mag-yapon. Ay, ano?
For public hearing, Madam Chair.
Okay. Public hearing, wala pa.
Honorable Sumabat.
Ang nalagay sa mga public hearing na.
Yes, Madam Chair, for public hearing, but still waiting for the others or for my ordinance maybe para mausa lang, Madam Chair, for the less expenses.
Sige, okay. Item G.
Item G, Draft Ordinance number 24-14, introduced by Honorable Zingnidas. And ordinance is setting the vaccination program by providing for vaccination champions in the municipality of Tudela.
Sige. May present the draft. Naman, may kopya na. Pagyakin na. Wala ginabot itong mga konti.
By providing for vacuna champions in the municipality of Tudela, providing funds therefore and for other purposes. Chapter 1, General Provisions, Section 1, titled, This ordinance shall be known as the Ordinance Institutionalizing Vacuna Champions of Local Government of Tudela, Misamis Occidental, and for other purposes. Section 2, Declaration of Principles and Policies. It is the policy of the municipality well-being of all its constituents by protecting communities from vaccine-preventable diseases, especially those most vulnerable. The municipality of Tudela shall contribute to the realization of this goal and shall adopt a participatory approach to prevention and elimination of vaccine-preventable diseases by mobilizing community action and engaging relevant non-governmental organizations, people's organizations, and vulnerable groups in the promotion, preparation, delivery, monitoring, and follow-up activities related to immunization. Section 3, General Objectives. This ordinance seeks to A, create the foundation for sustainable social mobilization through empowerment of community champions. B, recruit and develop a community-based team of volunteers available to support local health workers and other volunteer community health workers amplify health messages to shape positive behaviors on immunization and health. And letter C, decrease the burden of vaccine-preventable diseases by employing the social mobilization process to develop local strategies and activities to address vaccine hesitancy among vulnerable groups in the community. Section 4, definition of terms. As used in this ordinance, the terms below shall have the meanings ascribed to them in this section. Any words or terms not defined shall be given their plain and customary meanings unless the context requires otherwise and shall be interpreted in a manner consistent with the purpose and spirit of this ordinance. A. Bakuna Champion, a barangay-based volunteer health worker responsible for increasing vaccination coverage by addressing vaccine hesitancy and linking their communities with vaccination and related service providers. B. The barangay health worker refers to a person who has undergone training programs under any accredited government or non-government organization and who voluntarily renders primary health care services in the community after having been accredited to function as such by the LHB in accordance with the guidelines promulgated by the Department of Health. Letter C, community, refers to a barangay, group, or zone in a rural or urban area where a Bakuna Champion renders services. D, the gender expression, refers to the way a person communicates gender identity to others through behavior, clothing, hairstyles, communication, or speech pattern or body characteristics. Letter E, gender identity, refers to the person's sense of identity as characterized among others by manner of clothing, inclinations, and behavior in relation to masculine or feminine conventions. A person may have a male or female identity with a physiological characteristics of the opposite sex, in which case this person is considered transgender. F, the health promotion, refers to the process of enabling people to increase control over and to improve their health. G, primary care, refers to initial contact as accessible, continuous, comprehensive, and coordinated care that is accessible at the time of need, including a range of services for all presenting conditions, and the ability to coordinate referrals to other healthcare providers in the healthcare delivery system when necessary. H, the primary care worker, refers to a healthcare worker who may be health professional or community health worker or volunteer certified to provide primary care services. I, primary health care, refers to a whole of society approach that aims to ensure the highest possible level of health and well-being through equitable delivery of quality health services. J, registration, refers to a systematic process of enlisting a Bakuna Champion based on set of criteria promulgated by this ordinance. K, the sexual orientation, refers to the direction of emotional, sexual attraction or conduct towards people of the same sex or the homosexual orientation, or towards people of both sexes, the bisexual orientation, or towards people of the opposite sex, the heterosexual orientation, or to the absence of sexual attraction to a sexual orientation. And the social mobilization refers to a process that engages and motivates a wide range of partners and allies to raise awareness of and demand for a particular development objective through dialogue. And the vaccine hesitancy refers to the delay in acceptance or refusal of a vaccine despite its availability. And the voluntary service refers to activities engendered by Bakuna champions on his or her own free will, responsive to the needs of the community and for which he or she has a certificate of appointment and is not given any remuneration or salary. Chapter 2, the roles and responsibilities, Section 5, the local health board, the LHB, shall be primarily responsible for the registration of Bakuna champions in the municipality of Tudela, and for this purpose, shall A, safeguard the registration process, B, evaluate and take necessary action on the Bakuna champions application for registration, C, ensure that the board decision made on Bakuna champions registration is reflected in a board resolution or in the minutes of the meeting. D, issue certificates of registration to qualified Bakuna champions. E, review and approve every incentive or benefit for the Bakuna champion requiring the expenditure of local funds to ensure that only deserving Bakuna champions get the same. F, recommend benefits and appropriation of funds for Bakuna champions from the local government. G, maintain a registry of local Bakuna champions. And H, monitor the provision of services by registered Bakuna champions. To facilitate the supervision of the Bakuna champions, a Bakuna champions oversight committee may be created by the LHB to ensure the quality and effectiveness of the social mobilization program in promoting vaccine use and addressing vaccine hesitancy in the municipality of Tudela with the following duties and responsibilities. A, in the implementation, enforcement, and monitoring of this ordinance. B, evaluate the application and its supporting documents submitted by applicant Bakuna champions. C, interview applicant Bakuna champions and other parties as may be deemed necessary. D, recommend to the LHB appropriate action on the Bakuna champions application for registration. And E, coordinating with all concerned government agencies and private sector for the implementation of the program. Section 6, the Bakuna champions. The Bakuna champion shall continue discharging his or her voluntary service as a community organizer and educator enumerated hereunder. A, as a community organizer, he or she shall participate in organizing and mobilizing the community towards increased vaccination coverage by 1, maintaining regular communication with community leaders, volunteer health workers, and professional health workers. 2, providing linkage between the community and local health agencies. 3, facilitating referral and access to or association of the community with a relevant network of specific health and non-health service providers. 4, assisting the community to develop a health plan and to take action to promote their health and well-being through routine vaccination. 5, keeping records of the work activities and vaccination. And 6, developing appropriate knowledge and skills among community members to promote their participation in local vaccination initiatives. B, as an educator, he or she shall provide knowledge and skills to community members in promoting vaccine use by 1, conducting classes on promoting vaccine use and or household teachings. 2, updating knowledge of communities on relevant vaccination issues. And 3, distributing appropriate information, education, and communication materials related to vaccination. Section 7, the local health office. The municipal health officer shall be responsible for the managerial oversight of registered Bakuna champions as part of the vaccination and health promotion program of the municipality of Tudela. Responsibilities shall include but not limited to 1A, establishing baseline annual data on the burden of vaccine-presentable disease among affected and vulnerable groups and other related studies, and recommend further action on the findings of such data. B. Monitor and evaluate health outcomes in relation to the institutionalization of Bacona champions. C. Provide continuous and regular capacity development programs for Bacona champions. D. Provide health clearance certification for registered Bacona champions. E. Develop, promote, and implement essential health services inclusive of basic community vaccination services, and F. Implement education and promotion activities in various settings and subsectors in the community, especially parents and teachers, among others, and the appropriate linkage communities members with their respective Bacona champions. Chapter 3, Registration. Section 8, the Bacona Champions Oversight Committee. To facilitate registration of Bacona champions, the local health board may create a Bacona Champions Oversight Committee with the following core composition. A. Chairperson, the local health officer. B. The health education and promotion officer or equivalent designate. C. The local government operations officer. D. The president of the municipality of Tudela Barangay Health Worker Federation. E. Representative from registered Bacona champions. F. Representative from community-based NGOs or POs implementing community-based health or health-related programs in the municipality or city. G. Representative from community-based NGOs or POs representing key vulnerable groups. And H. Other members identified by the chair whose specific function in the local government unit and role may serve to effectively implement this ordinance. Section 9, Limitations on Registration. The LHB shall see to it that the total number of registered Bacona champions shall not exceed, insert value, the total population or household barangays of the municipality of Tudela. However, should the total number exceed the insert value, priority for registration shall be based on the need of the community for Bacona champions. Section 10, Qualifications for registration. The Bacona champion shall be registered with the local health board in the municipality of Tudela, in which they will their service. The registered Bacona champion shall be given appropriate proof of said registration. To qualify for registration, a Bacona champion must A. Must be of legal age, at least 18 years of age as of the date of the filing of the application for registration. B. Able to read and write. C. Be physically and mentally fit. D. Must be willing to voluntarily perform and be trained in the rules and responsibilities of a Bacona champion and other related functions as may be mandated by higher authorities. E. Must not have been convicted in any case involving moral turpitude. And F. Must have no conflict of interest in the delivery of primary care services. In no instance shall any physical disability, mental health conditions, the sexual orientation, the gender identity and expression, the socio-economic status, race, color, language, religion, ethnic, or social origin be made a qualification for Bacona champions. Section 11, Procedure for registration. A. Filing of application. The Bacona champion applicant shall submit to the Bacona champions Oversight Committee the following documents. 1. A duly accomplished application form. 2. A birth certificate or any official document in support of declared age. 3. An authorized declaration of conflict of interest. 4. Barangay clearance. And 5. A medical certificate duly signed by the health officer. Letter B. Evaluation of application. Upon submission of application to the Bacona Champions Oversight Committee of all required documents, the committee in its own shall 1. Evaluate the application and its supporting documents. 2. Evaluate the application on the basis of the other positions, designations, responsibilities held as volunteer community workers. And 3. Interview the applicant Bacona champion when deemed necessary. Letter C. Committee decision on the application for for registration, the Bakuna Champions Oversight Committee shall deliberate and decide on the application and the supporting documents within 30 calendar days from receipt thereof. However, the application shall be deemed approved should the committee fail to act within the said period. D. Posting of committee decision. The committee's action on the application for registration shall be posted and submitted to the local officials within 30 calendar days from the date of the decision in a conspicuous place at the municipality of Tudela, Misamis Occidental, and the barangay hall. Issuance of certificate of registration. Within 10 calendar days after the approval of the application, the Bakuna Champions Oversight Committee shall issue to the Bakuna Champion the corresponding certificate of registration and identification card signed by the chair or his or her designated representative. F. Notice of disapproval. A notice of disapproval stating the reasons for the decision shall be issued by the committee to the Bakuna Champion concerned. Section 12. The annual registration. The Bakuna Champion must register annually with the Bakuna Champions Oversight Committee. Accreditation for the first year of implementation shall immediately start after the activity thereof. For the renewal of registration, the following documents must be submitted. A. A duly accomplished form for renewal of registration. B. A certificate of service record for the year prior to the renewal of registration as certified by any member of the Bakuna Champions Oversight Committee. C. A proof of satisfactory performance rating in the year preceding renewal of registration. And letter D. A medical certificate duly signed by the local health officer. Chapter 4. Benefits and incentives. Section 13. Benefits and incentives for Bakuna Champions. In recognition of their services and to aid them to perform their duties, all Bakuna Champions who are actively and regularly performing their duties shall be entitled to a monthly honoraria in the amount of not less than, in addition to the following incentives and benefits. A. Training, education, and career enrichment. It shall be the duty of the local health office in cooperation with the Department of Health to provide registered Bakuna Champions the basic training program to be conducted by the local health office or a capable NGO within 6 months from the date of their registration. The local health office shall also provide continuous capacity development for the Bakuna Champions at least on an annual basis to ensure that they will be current in their knowledge of promoting vaccine use. B. The free legal services, legal representation and consultation services for Bakuna Champions shall be immediately provided to the Public Attorney's Office in cases of coercion, interference, and in other civil and criminal cases filed by or against Bakuna Champions arising out of or in connection with the performance of their duties as such. C. The medical examination. Compulsory medical examination shall be provided free of charge by the local health office to all Bakuna Champions and shall be repeated once a year during their service. D. Eligibility. As barangay health workers, all Bakuna Champions shall be granted preferential prioritization for registration as a BHW, given that the number of BHW shall not exceed the ratio of 1 BHW per 20 households. Their duration of service as Bakuna Champions shall be accredited as a prerequisite voluntary primary health care services necessary of BHW applicants prior to registration. Chapter 5, Financing. Section 14, Appropriation. Initial funding to defray the expenses necessary for or incidental to the implementation of this ordinance in the amount of shall be sourced from the fund of the city or the municipal government and is hereby allocated. Every year thereafter, then at least shall insert amount shall automatically be included in the annual budget of the municipality for the implementation and enforcement of this ordinance. The above expenses may include but are not limited to A. Cost of printing copies of this ordinance, information, education, and communication materials on promoting psychosocial and mental well-being. B. Cost of regular or periodic meetings of the Oversight Committee. C. Cost of inspection and enforcement by the Oversight Committee, including allowances for meals and transportation, which shall be set by the Office of the Mayor. D. The logistical support for Bacona champions. E. The benefits and incentives for Bacona champions. And F. Other expenses associated with the implementation and enforcement of this ordinance. Chapter 6, Miscellaneous and Final Provisions. Section 15, Repeating Clause. All ordinances, rules, and regulations or parts thereof found to be in conflict with or inconsistent with the provisions of this ordinance are hereby repealed or modified accordingly. Section 16, Effectivity Clause. This ordinance shall take effect 3 consecutive weeks after its publication in a newspaper of local or general circulation or posting at least 2 conspicuous places within the municipality.
Madam Chair,
Yes, Honorable Sigidas.
being the chairman of the Committee of Health, related to the proposed draft ordinance number 24-14, I suggest to remain this ordinance as a second reading, Madam Chair, considering further there is a little there is a need to refer to the RHU for the charges of appropriations and other monetary considerations, Madam Chair.
Okay. So, again, may I ask, how many Bacona champions each barangay will be having?
According to, for the meantime, according to the Torah, we will choose one representative, excluding the BHW.
So,
BHW are really considered
Pero barangay. Okay.
and the is also they are considered as automatic additional sa
Ang i-charge rin sa LGU, ang kasabot LGU, no?
abot kayo ngayon
Kasi man, the municipal government man.
oo, pero base nung iyang ikon sa kung sa po sa ilang forecasting forecast sa
I-consulta.
konsulta ka naman sa period application kasi dito na ma-charge kay dami na nakagaling sa kwarta para t-shirt at sa Tudela sa LGU, nakagaling sa free t-shirt para sa pagkagaling ng ito sa civil service sila may sponsor na ito sa mga t-shirt natin ako
Yes, narabutan po.
Thank you, Madam Chair. As mentioned by the Honorable Sigidas, Madam Chair, yung pagpuno na po aside sa existing ato mag-install sa barangay PNS, madugang. So, ato siguro iklaro ni with the RH personnel, image ko. Kaya kung magdugang, totally, Madam Chair, i-appoint na directly sa barangay, no? Kaya gamit sa barangay. So, mag-add on lugar o additional na appointed barangay as BHW ba o Bacona champion sa barangay na may existing ang mga BHW na ito sa barangay. So, part siguro na ang atong iklaro ni Doktora para matanaw na ito kung acceptable ba po.
Sa mga ka-appointment.
Oo, sa barangay.
Budget man sa LGU.
Ang LGU, so kita mo yung mag-appoint ka barangay. So, ang ato diya is umiyan na karoon ng i-consulta nga source, kung saan man ang i-consulta, ang doktor bagay ng magpapili na, dahil ang ordinance na aso, kasi kita na nung sagot sa LGU nga level na pag-abot sa panahon. So, thank you, Madam Chair.
so noted, Madam Chair. Noted.
Pero mahirap mo pa ba? Benefits na ba yun?
Ang BHW, Madam Chair, na nag-1.5, na nag-1.2, ang pinakagamay siguro 1,000.
Meron rin ako. Pero alam ko scope sa iyo kung ano na iba ko naman ako na.
Kasi ganun kung tayo mga bakuna. So, ang mark yan, parang ako Madam Chair, may siguro, na siguro ang mga BHW, existing din sila. Then sila nang maging po na yung assist kung na yung mga ordinance sa barangay. Ang may diliana, ang champion niya batay, katong mga 100% sila makuna, kaya itong nag-workers na ito, kaya itong taga-bring yung additional benefits kung makakomply sila sa 100% yung compliance sa bakuna.
Okay, sige. Anyway, let's continue. The deliberation by
Designate na sila ng mga bakmo sa 2 business or
So I will refer this to the Flora regarding the concern of the group, Madam Chair. Thank you.
Okay, thank you. I wasn't just...
Okay, so next, working pa na ta. Working po na.
next. Draft Ordinance number 24 as 18 introduced by Honorable Mixton. An ordinance to regulate the drawing of waters from its natural source within the territorial jurisdiction of Tudela and imposing penalties of violation.
Ako amin. Marino.
Amendment of
Okay, continue. Nagkakakarap.
For barangay consultation, upon receiving the notices of application, the barangay chairman shall invite the applicant and conduct public consultations and verify any protest prior to the granting of a barangay clearance or resolution to the applicant. All participants shall be subject to the provisions of Section 9 of the IRR of PD 1067. Section 5, the local requirements. The following local permits are prerequisite to the processing, approval, and granting of a water permit through the DNR or SEDLO. A, zoning clearance. B, barangay clearance. C, mayor's permit or business permit to operate for the operators of the business. And D, the local grading permit for the grading contractor. Section 6, the local government with the municipal council and with the concurrence of the local chief executive may recommend to the DNR or the SEDLO to the suspension or revocation of a water permit for violations of the provisions of Chapter 3, Article 28 and 29 of PB 1067. Within its territorial jurisdiction or with an adverse effect on the environment, such as the occurrence of fissures or ground subsidence due to the continuous extraction and over-exploitation of groundwater in the locality, is evident which could affect the safety and general welfare of the inhabitants. Section 7, definition of terms as used in this ordinance. 1, natural source shall mean aquifers or underground layer of porous rock containing water. 2, water shall refer to water under the ground, water above the ground, water in the atmosphere, and waters of rivers, lakes, streams, lagoons, springs, and brooks running in their natural beds and the beds themselves within the territorial jurisdiction of municipality of Tudela.